How do atypical antipsychotics affect glutamate levels? Have you ever wondered how medications for schizophrenia interact with brain chemistry? One of the key players in this complex scenario is glutamate, a neurotransmitter that plays a vital role in brain signaling. Atypical antipsychotics, commonly prescribed for schizophrenia, have been studied for their effects on glutamate levels. Research shows that individuals with schizophrenia often have elevated glutamate metabolites in specific brain regions. These areas include the basal ganglia and the medial temporal lobe. The levels of glutamate can vary based on the stage of the illness and the specific brain area involved. Interestingly, higher glutamate levels may correlate with more severe symptoms and resistance to treatment. When it comes to atypical antipsychotics, studies indicate that these medications generally lead to a modest reduction in glutamate metabolites. Most research reports a numerical decrease in glutamate levels after treatment. For instance, some studies have observed reductions of around 6.5% in glutamate-related compounds. However, this effect is not uniform across all patients or brain regions. In certain areas of the brain, such as the anterior cingulate cortex, which is crucial for cognition and emotion regulation, the impact of atypical antipsychotics on glutamate levels is less clear. Some studies have found no significant change in glutamate or combined glutamate-glutamine levels after treatment. This suggests that the response to these medications can vary by region. Mechanistically, atypical antipsychotics may influence glutamate neurotransmission in several ways. They can modulate glutamate releases, interact with glutamate receptors, or alter downstream signaling pathways. This modulation could help address glutamatergic dysfunction linked to schizophrenia symptoms, particularly those cognitive and negative symptoms that traditional dopamine-targeting antipsychotics may not fully address. From the perspective of schizophrenia treatment, these findings suggest that atypical antipsychotics may partially correct glutamate abnormalities. These abnormalities are believed to contribute to the complex symptom profile of the disorder. However, the degree of glutamate modulation by these drugs is limited and can vary significantly among individuals. This indicates that addressing glutamatergic dysfunction in schizophrenia may requiring additional or alternative treatment strategies beyond the current antipsychotics. In summary, atypical antipsychotics generally lead to a modest reduction in elevated glutamate levels in individuals with schizophrenia. The effects depend on various factors, including the specific brain region, the stage of the illness, and individual patient characteristics. This glutamate modulation may play a role in the therapeutic effects of these medications, especially for symptoms that are not fully managed by dopamine antagonism alone.